Medical billing. This is a step-by-step guide to medical billing. The important terms we'll cover: CMS 1500, pre-authorization, CPT code, ICD-9 code, preventive services, pre-existing condition, deductible, J-code, which is also called joint commissions, new patient, established patient, copay or copayment, EOB, fraud, abuse, inpatient, outpatient, medical necessity, accept assignment, modifier, and NPI. The paragraph states, there are many terms that you should become familiar with if you're going to be in the medical field, especially as medical billing specialist. This instruction manual is designed to assist those already in the medical field, or if you are trying to submit your own claims on your own behalf. Because some insurance companies do not reimburse medical facilities adequately, some offices do refuse to accept certain insurance company plans. For this reason, some people actually have to fill out their own claim forms. This will also benefit them. Step-by-step medical billing guide. We will cover these in this order. The CMS 1500 form. Instructions, we will go blank by blank on the form. Super bill or encounter form. You are familiar with that already. Patient demographic information, patient's authorization and signature on file insurance claims, and patient's insurance cards. You want to make sure you always photocopy the front and back. This is a copy of a CMS 1500 form. It used to be called a HCFA, HCFA 1500 form. The Center for Medicaid and Medicare Services actually determines what the forms, and they regulate the forms for us. You've seen that before, super bill or encounter form. The top of that form have all the procedure codes. The doctor will check the procedures performed. The bottom of this page are the diagnosis codes, and once again the doctor will indicate which ones what diagnosis they are labeling for the patient. Your demographic form, once again you are familiar with this form already. Triple authorization form. Don't forget, we covered in medical office clerical that it's very important to understand accept assignment, and that is saying that your medical office accepting the insurances that the patient has. Release of medical information. The patient's authorizing you to release medical information for insurance purposes to file electronic claims. Some insurance forms also have the release of medical information, so they will actually be able to give information to another parent or to a spouse. And the financial agreement. The patient is responsible for paying the bill regardless of whether or not they have insurance. The last paragraph, once again, I hereby authorize the physician of, that's blanked out, to furnish information to any referring institution, physician concerning my illness and treatment, furnish information to insurance carriers concerning my illness or treatment. Insurance card. Once again, we've copied the front and back of two insurance cards. One is Humana and one is Anthem. Look at the Humana card at the top. The important identification information is the subscriber, the group ID, member ID, and the member name. In the middle of the card you have OFC visit, that's the office visit, the copayment. It says 20/40. 20 is for a regular physician, and the 40 with an S behind it means specialist. So for a specialist, you're paying 40 for the copayment. Pharmacy benefits, we have different tiers. The lowest tier, which is the cheapest medications, the copay is 10. The second tier, the copay is 30. Third tier, the payment is 50. And then above and beyond that, you have 25%. ER copay is extremely high, $150. That's to deter people from actually going to the ER for treatment. The back of the Humana card gives contact information if you have any questions regarding any of the coverage for Humana. Once again, all insurance companies have websites. It's a lot easier to go on the website and find out your information than to make a phone call, and you'll be on the phone forever. The Anthem card. Once again, it has a subscriber name, the ID number, group number, plan number, and then it also covers the office visit copay is 15. For a specialist, it's also 15. ER is 100. Urgent care is 50. and then you have your tiers for your prescriptions, and then you have inpatient and outpatient services. The back of the card, once again, has phone numbers. Okay, let's start with filling out the CMS form. At the top of the insurance claim form is number 1, and that identifies the insurance coverage that the patient has. The computer will check this information automatically because at checkout, remember that the checkout receptionist has filled out the demographic information in the computer, input all the patient data, so by the time that the billing department receives the super bill or the encounter form, all the information is in the computer that they need. So all they should have to use is the encounter form. Number 2, patient's name, last name, first name, middle initial. Number 5 is the address, patient's address. Now, if you look on the form, we're going straight down, and that's just the way the form is filled out. The next section is 3, 6, and 8. Patient's date of birth, whether the male or female. Number 6, patient's relationship to the insured, whether it's themselves, a spouse, child, or other. Number 8, patient status, is the patient single, married, or other, employed, full-time student, part-time student.